Hi, my name is Steve Purves, President and CEO of Maricopa Integrated Health System. For over 140 years, our organization has been the community's only public teaching hospital and system of care. We provide essential services to those who live and work in Maricopa County, and we are proud of the special role we play in our community. First and foremost, each year we train approximately 325 doctors, making us the largest teaching hospital in metropolitan Phoenix. Second, we serve as a safety net, filling critical gaps in care for underserved populations and the uninsured. Fully 1/3 of our patients do not have the means to pay for their health care. Third, we offer a network of health centers in communities across the county where primary care services are the front line of defense for keeping people well, managing chronic illnesses, and providing care cost effectively. Lastly, as a publicly funded healthcare district, we are the only medical system in our community that is directly accountable to you, the taxpayers. The strategic plan approved by our Board of Directors fulfills the MIHS Teaching and Safety Net mission. First, MIHS's strategy is to build an integrative hospital campus. Our goal is to teach and train physicians, nurses, pharmacists, and allied health professionals, organized around the needs of patients, using technology to deliver better care, improved outcomes, and lower costs. Second, the MIHS strategic plan allocates a greater share of system resources to grow access to primary care and specialty services in underserved parts of the county. As the Maricopa County population has grown, the need for these kinds of specialty services in the East Valley and West Valley has increased. Our Phoenix Comprehensive Health Center is simply too far from the populations who need us. We must be able to provide access to care and affordable outpatient specialty services to the East Valley and West Valley residents of Maricopa County. This enhanced capacity will reduce wait times, improve access to specialists, and avoid overuse of the hospital emergency department. Third, the MIHS strategic plan recognizes gaps in access to behavioral health services in Maricopa County. The current MIHS behavioral health facilities are at capacity and cannot meet current community need, much less the growing future needs. To address those needs, our plan calls for the expansion of behavioral health services to ensure that Maricopa County residents have access to the levels of care they deserve. Fourth, the MIHS plan calls for the replacement of the obsolete teaching hospital, Maricopa Medical Center. A new hospital will enable us to train medical professionals in a team-based and technology-enabled environment, as well as to improve the care of patients, particularly those who need our specialty trauma and burn services. Finally, MIHS offers a full continuum of services for the community and is exactly the kind of model required for the future of healthcare reform. MIHS is not just a hospital or a health clinic, but an academic training center, a regional provider of specialized services, and a source of high-quality care for the indigent and vulnerable. MIHS touches virtually every corner of the county through its services. It is as relevant now as it has been for over 140 years. Investing in MIHS will enable us to continue our voter-mandated mission of training the next generation of healthcare providers for our community and our region, providing safe, reliable, quality care to the underserved of Maricopa County, and functioning cost-effectively as good stewards of our community resources. Because we are an institution that serves all of the community, we need your support and that of the entire community. Thank you.